We're doing the abdominal examination today. This is our patient Chris. So first of all, can I ask you to lay back on the bed, please? And this actually allows the abdominal muscles to become relaxed for the examination. We would undrape the patient's abdomen in order to do an actual examination. It cannot be done over the gown. You cannot listen over the gown. It is actually, it could give you inaccurate sounds. So we'll pretend that we undrape the patient. I can see that his abdomen is flat. There are no obvious masses. There are no pulsations. The skin is completely normal, no scars, no rashes or abnormal discolorations found on this patient. Um, and then on the abdominal assessment, we move on to auscultation right away. Um, so we'll begin auscultation in all four quadrants of the abdomen. We'll begin on the right upper quadrant. We'll move on to each side, each other quadrant. We're looking for vowel sounds that are normal active. And hyperactive sounds can indicate illnesses such as diarrhea, colitis, enteritis, things like that. And of course, an abnormal absence of vowel sounds could indicate an obstruction or perforated vowel or things like that. Okay, so we'll begin our auscultation with the diaphragm or the stethoscope. And I do hear normal active vowel sounds in all four quadrants. There are no obvious other sounds noted, but we'll assess for bruit. And the way we do that is with the bell, we're going to place it in the, try to find the abdominal aorta. We're looking for any brewing there. We will also look at the femoral arteries and make sure that there are no bruit there, or the iliac arteries as well. So we'll do that. And at this time, I do not hear any bruit or friction rubs. After auscultation, we will perform the palpation part of the exam. Actually, we'll do the percussion part of the exam next, and then we'll move on to palpation. So for the percussion at this time, we're going to look for tympany foremost all over the abdomen. We might hear some dullness if we encounter liver enlargement or the area where the liver would be. And then we might also encounter dullness if there are other abnormal conditions happening. And this patient presents tympany all throughout the abdomen. We'll move on to palpation. We'll begin with light palpation. We're starting with the light touch because we want to make sure that there is no tenderness or special areas of that the patient is guarding. So we'll begin with light palpation. You tell me if anything hurts, okay? Okay. All right. in this patient, during not light palpation, he presented no tenderness, no guarding, no muscular resistance. So we'll move on to deep palpation. During this process, we're looking for masses or abnormal growths. We'll also look to find the liver ridge. And sometimes the way we can do that is, can you take a deep breath, please? And at this point, you can try the hook approach, especially if the patient is overweight. That may be helpful in identifying the actual liver ridge. Percussion sometimes is also, you're also able to identify the liver ridge because you will hear dullness when you're percussing over the liver. Patient's liver is not palpable at this time. We will actually also do the assessment to make sure that the kidneys are not palpable. Okay, and so the way we'll do it, I have to make sure that I'm doing it correctly. And then, so we're going to put one hand posterior abdomen, one hand anterior abdomen. We'll try to see if there's any enlargement to the kidneys. Can you relax your arms by your side? Again, as we want right here. This is right here. Okay, same thing on the other side. And the kidneys are not palpable, and the patient does not present any tenderness. So that would be the end of the abdominal assessment.